Let's face it, red, bumpy, and itchy skin can be annoying and sometimes embarrassing. And no one wants that, and it can affect your everyday life. One of the most common culprits for this is skin allergies. That's what happens when your body encounters something it thinks is dangerous, and it causes your immune system to overact, resulting in symptoms like having rashes or maybe swelling. But you don't have to suffer in silence. Today, we'll talk about what causes these allergies, how you can treat them, and let you get that confidence back up. I'm Dr. Freddy Gomez. This is MedTalk Health Talk, where your healthcare comes first. Irritated skin can be caused by a variety of factors that include immune system disorders, medications, infections, and contactants. Now, to talk more about this topic, we have Dr. Jasmine Hamora. She's a dermatologist and training officer at Skin Cancer Foundation, Incorporated. We're also joined by Dr. Pauline Florence Santos Estrella. She's the head of the Dermatologic Allergy Council of the Philippine Society of Allergy, Asthma, and Immunology. We're very glad to have both of you on the show. Now, when you have skin allergies, it means you have an oversensitive immune system. And what happens is you develop allergic skin rashes and maybe other conditions. Dr. Pauline, could you explain what allergies are and how it's related to our immune system?
When a person is exposed to a certain allergen, she develops or he develops whether a rash or rhinitis or asthma, her body reacts to it.
Now, Dr. Jasmine, when it comes to someone's skin, could you please tell us what are the common causes naman ng skin allergies?
Usually for contact dermatitis, the 5 common allergens can be fragrances. Okay, so I'm actually allergic to fragrances like in perfumes, rubber, like in rubber gloves, okay, hair dyes, a substance called paraphenyldiamine, and there are many other things like nickel. So nickel is like what we find in fancy jewelry. So yun. And also for people who are very sensitive, dust and house dust mites. So these are mga common allergens, Freddy.
Yes, they're everywhere here, especially if you live in the city. Now, skin allergies can be a little tricky because the first time you come in contact with, say, a bee sting or peanuts or latex, nothing may happen and you may think everything is okay. Now, it's the second or third time that you come in contact with that same allergen that your body now will react differently to it. Now, Dr. Pauline, how can one know if he or she has an allergic reaction? What are the most common signs? And what's the different signs as opposed to just being irritated with something that they come in contact with?
Your body reacts to it in different ways. No? So you can either have a rash, you can either have very mild reactions like rash, or you can have a very severe reaction like that of the anaphylaxis, what we call anaphylaxis. So in between, sometimes people may have difficulty of breathing. Sometimes people vomits or have abdominal pain. They pass out.
Now, skin allergies come in different forms. Dr. Jasmine, earlier you talked about what are some of the common triggers of skin allergies. Now let's talk about yung mga common allergic skin conditions.
Yeah, absolutely. So contact dermatitis is really quite common. And what it is when a substance touches your skin, you can get allergic to it. So there are 2 types, no? One is called irritant contact dermatitis. Ito, Freddy, this is where we have a strong chemical that touches the skin and it will really irritate it, no? So usually this is not an immune response. Madaming taong magkakaroon ng rashes dito. Kunwari bleach or some other strong chemical that touches our skin. So everyone will get an allergic, parang irritant reaction to this. Yung allergic contact dermatitis naman is a little bit less common. This is very specific to people, no? So like me, I have an allergic contact dermatitis to perfume, but not everyone has allergic contact dermatitis to perfume. So this one is an immune-mediated reaction. It is delayed type, so it takes some time. And your body has to be exposed first to the allergen. And then later on, when it meets that substance again, nagkakaroon sila ng allergy. So yun po yung contact dermatitis, Freddy.
So in that case, Dr. Jasmine, if someone encounters that they have an irritation because of contact dermatitis, is this something that they need to seek medical attention right away?
Yeah, no? So usually, if you can identify kung ano yung substance na nag-trigger ng contact dermatitis, you can just avoid it, no? Kunwari, alam mo allergic ka sa hair dye, 'di ba? Nagpa-hair dye ka, namula yung scalp mo. Alam mo that you're probably allergic to it. Wag mo nang gamitin, ano? So if you avoid it, eventually it will just go away. Pero if you keep on using that allergen o yung substance na kung saan ka allergic, babalik at babalik yun, ano? So if you cannot identify what is the source, and hindi na po nawawala yung allergy natin, it's time to see a doctor, no?
And as a gentle reminder, contact dermatitis can lead to an infection from scratching the affected area repeatedly, causing it to become wet and oozing. And this creates a good place for bacteria or fungi to grow. Now, skin allergies can also cause hives and swelling deep inside your skin, called angioedema. We'll explain more when we come back. You're watching Med Talk Health Talk on CNN Philippines. Have you experienced having red-colored skin bumps that appeared quickly then disappeared just as fast? These aren't simple bug bites. This type of skin rash could be hives. We're together in health. I'm Dr. Freddy Gomez. Now, hives can appear in different shapes and sizes anywhere on your body. This type of rash is often itchy and sometimes feels like it's stinging or burning. Hives occur when something causes high levels of histamine and other chemicals to be released into the skin, and this is called a trigger. Now, let's talk about these triggers. Dr. Pauline, ano-ano po ba ang mga ito, itong mga triggers na sinasabi?
Well, ang hives or urticaria can have a lot of triggers. No, it can be secondary to a medical condition like an infection, acute infection, or some autoimmune diseases. It can also be secondary to a lot of triggers, like, for example, food, medications, drugs, insect bites, and it can also be secondary to physical factors, like, for example, when a person encounters very cold, warming up after a very cold environment, and then also some stress and pressure, heat, exposure to heat, and also exposure to sunlight.
Now, symptoms of hives can last from minutes to months, even years. And while they resemble bug bites, they're different in several ways. Dr. Asmin, could you discuss for our viewers first the symptoms of hives?
Sure, Freddy. Actually, yung mga tao, no, when they get the hives or sometimes tawag nilang stagulabay, they will feel na parang tinutusok, no? Parang may tumutusok sa balat nila or it's very, very itchy. Sometimes mainit siya and sometimes it can feel like it's tingling, ano? So you can see anywhere from maliit like bug bites, like insect bites, or pwede siyang parang mapa, no? Sabihin nila, Doc, may mapa na naman ako dun sa katawan ko. So these hives will usually disappear in about 24 hours and they can appear on different parts of the body, no? Pero and it usually doesn't leave any stain. Wala siyang parang scarring or hyperpigmentation. Pero if it lasts more than a day and it's persistent, then it leaves mga marks, it's probably time to see a specialist.
Speaking about that, the itchy skin that someone feels at night can be severe enough to disrupt your sleep. Dr. Asmin, is there a certain time of day when hives become worse?
Actually, Freddy, hives can appear at any time of day, no? But usually at night, it can feel worse or more itchy. There are several things that happen to the skin at night, no? Our temperature of the skin actually goes up and the blood flow goes up. So parang umiinit yung skin. And when our blood vessels kind of dilate, pag mainit siya, mas makati, ano? And also at night, our natural steroids, which are immune suppressants, go down a little bit. So yung parang inflammation, mas prominent siya, no? So parang mas makati siya sa gabi.
Now, Dr. Pauline, what's your best advice for our viewers then knowing that hives can get worse?
They have to monitor the times or when or what is related, or if there are some triggering factors that they can identify, like, for example, if they're exposed to this dust mites for pet danders, they are also using a new drug or a new medication. Most probably, baka they have parang a new infection. So, ang ina-advise namin is to really seek consult from the either from the dermatologists or from us allergologists for us to help you identify, no, kung saan talaga or ano yung pinanggagalingan.
Now, if your skin itches and turns red every so often, you might have eczema. It usually appears in children, but adults can be affected as well. Now, people with eczema have a higher risk of having allergic conditions like asthma or maybe hay fever. Dr. Hasmin, what happens when you have eczema? And what's the connection between eczema and asthma?
Okay, thank you for that question. So, Freddy, ang tawag natin na eczema, we more properly call it atopic dermatitis, but some lay people may know this as skin asthma, no? Although some people kind of fight about that term. But it's part of a spectrum of diseases, no? Related siya, no? Itong atopic dermatitis, bronchial asthma, tsaka hay fever, no? Since Dr. Estrella is also an expert in this. So it's usually characterized by three things, Freddy, no? So one is a genetic lack of a moisturizer in our skin. So talagang very dry skin yung mga taong may atopic eczema. Secondly, altered yung immunity nila, no? So they have a very high hypersensitive immunity. They're very sensitive to environmental allergens, and also at the same time, medyo prone sila sa mga infections, no? Like bacteria, fungus, and virus. Then thirdly, pabalik-balik siya, no? So there's a strong family history. Sa family, usually may hay fever, may asthma, meron din skin eczema, pero pabalik-balik siya. So it can come back and forth, and it can be triggered by several things, no? So like dry weather, cold weather, change in weather, mga dust, sweating, so mga infections. And in a small proportion of patients, 1/3 to a half, they can be even sensitive to food and allergens in the air, no? So that's what eczema is.
Now, for those with eczema, good skincare is key to keep that itchiness at bay. So if your eczema is mild, that may be all you need, along with some daily habit changes. Dr. Hasmin, please share with our viewers the best way in order to treat eczema.
So, Freddy, in all patients who have eczema, yung number one recommendation talaga namin is moisturize, ano? So, even though we're in kind of a tropical climate, for some reason, talagang dry yung skin nila, no? So, we have to put moisturizers, no? Secondly, we have to individualize it, no? Tell them to avoid the triggers, as Dr. Estrella talked about. And then, of course, thirdly, we have to determine ganong kagrabe ba yung eczema nila. Is it mild? If it's very, very itchy, there are topical steroids that we can use. There are also some non-steroids like topical calcineurin inhibitors that can be used safely, no, depending on the age. Tapos kung talagang grabe na, Freddy, we can think about light therapy, no? Yung tinatawag namin na phototherapy, papailaw lang yung patient and it will really help their skin get better.
Now, Dr. Pauline, a lot of new moms out there may look at their child and medyo worried na sila kasi maraming sigurong mga nakikita sa balat. So my question is, what does eczema on babies look like? And does this go away on its own?
There are normal rashes in the infancy stage, but usually when they see their babies, like parang yung very itchy na siya, diba? So parang minsan kinakaskas nila doon sa higaan nila. And then there are rashes or blotches that appears in their cheeks, in their arms, and then the folds of their the upper arms and yung sa likod, sa alak-alakan. So those are probably signs of atopic dermatitis na.
When you break out into a rash, it's natural to wonder what caused this. When we come back, we'll talk about when you should see a doctor and the tests used to determine if you have a skin allergy. You're watching Med Talk Health Talk on CNN Philippines. Having skin allergies goes beyond the itchiness and being uncomfortable. It can also affect someone's self-esteem and confidence. I'm Dr. Freddy Gomez. MedTalk Health Talk is your connection to healthcare. During allergy skin tests, your skin is exposed to allergens, then it's observed for any signs of an allergic reaction. Allergy tests determine whether something you touch, eat, or inhale is causing your symptoms. Now, information from these allergy tests may help your doctor develop the best course of action for your condition. Dr. Pauline, what happens during allergy testing? Please walk us through this procedure.
So usually what we do, we introduce a diluted allergen on the skin, and then we just puncture or prick it. And then we wait for 15 minutes, and then if there's we observe for bumps or wheals and sometimes flare, then Then we interpret the result. So if the smaller bumps or the bigger bumps or wheals may indicate greater sensitivity to that certain allergen.
Now, Dr. Pauline, meron bang dapat i-prepare ang mga kailangan magpa-allergy test? At ang palaging common na tanong is, masakit ba ito?
First, in preparation for the skin test, we advise the patient to stop, if it's possible, to stop their antihistamines at least minimum of 3 days. Actually, 3 to 7 days is the recommendation. And if they also are taking some antidepressants and H2 blockers, like for example, ranitidine, famotidine, we also advise them to stop those at least 2 days. Masakit, I just explain to them that it should not bleed. The test should not, the puncture should not bleed, because it's just percutaneous. It's just on the skin. You just have to scratch it. Sometimes they would feel more of itchiness rather than pain. So baka nami-misinterpret lang nila yung feeling of pain with the itchiness. So pwede kasing ganun eh.
Now, whenever someone has something on their skin for a longer period of time, it's always best to have it checked by your doctor. But, Dr. Yasmin, what are some things that our viewers can do at home to sort of ease the symptoms that they're feeling on their skin?
Sure, absolutely. Although, Freddie, I really don't recommend that people treat themselves, no? They can, first of all, try not to apply anything irritating to the skin. Secondly, bland emollient or a bland moisturizer can really help a lot of itchy problems, ano? And then, generally, try to take a short bath. For kids with eczema, we recommend that the parents can try an oatmeal bath. So you can buy some colloidal oatmeal, put it in a bath, and then the kid can soak for a little bit, no, like mga 10 minutes. Then immediately after that, they can put the lotion on the skin, no, the moisturizing lotion. Tapos kung sobrang kate, you can teach the kid na wag niyang kamutin kasi minsan pag kinakamot natin, nasusugatan niya, no, nagdudugo, nagkakaroon ng infection. So they can just parang tap the skin, or you can cover their hands with parang mittens or gloves para hindi nila masyadong kamutin. And then make sure that the clothes that we wear hindi masyadong hapit, tapos cotton and loose para cool yung tao palagi, hindi na-irritate yung skin nila. That's pretty good, I think.
As a follow-up question, Dr. Yasmin, I'm sure a lot of viewers go to drugstores and see the vast array of different skin moisturizers and creams. What type of moisturizer should they use? Are moisturizers better than medication? So what should be their mindset when treating their skin?
Sure. I suggest that they stick to mga blando, meaning to say walang pabango, walang fragrance, wala masyadong mga ibang things like antimicrobials or whitening. Try to just keep it fragrance-free and hypoallergenic, no? So usually if you aim for that, your skin will react quite better. So try to keep it mild. Yung mga baby level na products usually are pretty safe, no? So I do recommend that they use that first. And then if you're not getting better, please go see a doctor na.
There you have it. That was one interesting discussion. And with that, I'd like to thank our guests for today, dermatologist Dr. Yasmin Hamora and allergist Dr. Pauline Santos Estrella. We appreciate your time and effort very much on the show. Skin allergies are unfortunately quite common, and while they aren't life-threatening, most of the time they can cause you to get very irritable. The effect on your skin can harm your self-esteem. So before any of that happens, go see your doctor so you can get the care you need to look and feel your best. I'm Dr. Freddy Gomez, helping build a healthier future for you. Thank you for watching.